virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terrence Deyalsingh, and Dr. Hazel Othello, Director Mental Health at the Ministry of Health. The Minister of Health, the Honorable Terrence Deyalsingh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to ladies and gentlemen of the media and to all citizens of Trinidad and Tobago, wherever you may find yourselves this Wednesday morning. Also, good morning to Dr. Hazel Othello. So today is Wednesday, the 6th of May. Where are we globally with our figures? As of now, there are 3,756,264 cases of coronavirus around the world. So we are closing in on 4 million in some time to come. Deaths to date are 259,436, over 250,000 people. Recovered persons to date, the numbers are 1,258,363. Ladies and gentlemen, before I give the usual local clinical update, I just want to alert you as to some information that came out from PAHO WHO. And although the report is dated April 30th, 2020, and is 6 days later, I think the information is important. The numbers may change, but the overall picture is what we want to focus on. This report says, as of April 30th, a total of 1,159 confirmed COVID-19 cases, including, at that time, 62 deaths have been reported from all 20 CARICOM member states. In CARICOM, 20 member states, 1,159 cases and 62 deaths. That is what CARICOM is faced with. Of these, 9 are in phase 2 of the outbreak, which is sporadic cases. And you would have heard the CMO say that is where we are so far. And 11 are in phase 3, where you have clusters of cases. And that is where we don't want to go. We would like to remain in sporadic case category for as long as possible. I bring this to the national attention so that we understand that the fires of COVID-19 still rage around us in our backyard. And the fires that we have doused in Trinidad and Tobago could reignite at any point in time and move us from sporadic to clusters. The national conversation over the past couple of days, in my view, seems to be going towards now a state of complacency, that we have beat the virus, eradicated the virus. We have done no such thing. What we have done is, by taking serious measures, is that we have suppressed the virus. The fires are still raging. Where are we with the status update as of today? Total number of tests done, 2,114. The total number of community tests, 524, and as of to date, all 524 so far are negative. Total number of unique patient tests, 1,782. Total number of repeated tests, 332. The total number of positive cases is 116. It remains more or less constant. Total number of discharges, 103. Total number of deaths, and our deepest condolences go out to these 8 families, remain at 8. 7 in Trinidad, 1 in Tobago. Total number of hospitalized patients across the spectrum of care in hospital setting is 1. That 1 person is in the high dependency unit in Couva. So in Couva, we only have 1 patient at this point in time. At the Home of Football in Couva, we have 4 persons. At the Racket Center in Tacarigua, thankfully, we have no persons there. All of them are now back home, and I want to really say how happy we are that they are back home. In Debe, we have 69 persons, and in quarantine at Napa, we have 20 healthcare workers, all negative. These are just people who, when they finish their tour of duty, living with patients either at Sangre Grande or at the Racket Center. Remember, these healthcare employees leave home and volunteer to live with these patients. We have 20 persons in Napa. That's where we are. Ladies and gentlemen, you may recall on Monday, it was indicated from this platform that moving forward, post our first wave, in preparing for our second and third waves, we have to be cognizant about the mental and psychosocial condition of the country. At that time, it was indicated that Dr. Hazel Othello will be back here to give you some details about what the Ministry of Health is doing to support the country. Because when you look at all the literature coming out of WHO and everyone else, it talks about worry, fear, and concern. We know that rates of stress and anxiety are going up because of isolation and quarantine. And there are 2 particular populations we are concerned about. The elderly, who may not understand what is going on, and also children who may not understand what is going on. To this end, our mental health response to deal with COVID, we are going to present to you this morning the outline of a national plan, where we held consultations with a range of stakeholders, NGOs, professional organizations, the University of the West Indies. And we have set up a technical working group that will have a life of its own to adapt and adopt plans as we move forward. The sole objective of this is to walk the country through any mental health challenges that may arise. And as needs change, we will be providing the regular and necessary mental health support, psychosocial support. And what we will do now, after I hand over to Minister Cox, is that Dr. Hazel Othello will give the country and members of the media an outline of what our plans look like as we support Trinidad and Tobago moving forward in our part of dealing with this global pandemic. Thank you very much, Minister Cox.
Thank you, Minister. You have already introduced us. So Dr. Hazel Othello, you are on.
Thank you, Honourable Ministers, for yet another opportunity to speak to Trinidad and Tobago about mental health. Good morning, Trinidad and Tobago, and listeners and viewers wherever you may be located at this time. And thank you, Minister, as well, for providing the context for what I'm going to share this morning. The COVID-19 pandemic is a dynamic environment in which the adaptation of global health systems to meet current and anticipated demands has defined responses. Locally, mental health service providers, such as the regional health authorities, very quickly responded to the urgent need to ensure that support was available to persons who tested positive, persons in quarantine and isolation, and frontline workers. Simultaneously, the Mental Health Unit of the Ministry of Health began a program of public messaging aimed at assisting persons in coping with the challenges of the pandemic, while a number of local professional organizations, non-governmental organizations, and other mental health stakeholders began to adapt and expand their services in order to assist in meeting the growing needs. The Ministry of Health has recognized the need to partner with these organizations in the provision of a robust national response to the psychosocial impact of the COVID-19 pandemic. The mental health unit of the ministry has also collaborated extensively with the Pan American Health Organization, PAHO, to ensure that the response is consistent with international best practice recommendations. Mental health and psychosocial support, abbreviated MHPSS, is a term used by the Interagency Standing Committee of the United Nations to describe any type of support that aims to protect and promote psychosocial well-being and/or treat or prevent mental health conditions. This term is used to unite a broad range of actors responding to emergencies such as the COVID-19 outbreak, including those working in biological approaches and sociocultural approaches in health, social, education, and community settings, as well as to underscore the need for diverse, complementary approaches in providing appropriate support. A mental health and psychosocial technical working group, as mentioned by the Honourable Minister, has been set up and is currently chaired by the Director of Mental Health Services, that is myself. This group has been established and it will meet weekly for the months of May and June, and subsequent to that it will meet bi-weekly for as long as is required. The technical working group recognizes that, as has frequently been stated by the Honourable Minister of Health, this is not a sprint, it's a marathon. And the group is committed to ensuring that the appropriate MHPSS services reach every identifiable target group within our communities throughout the duration of the pandemic and beyond, in order to reduce suffering and improve mental health and psychosocial well-being of persons affected by the global COVID-19 pandemic. The inaugural meeting of the Technical Working Group was attended by representatives of 23 organizations, and several others sent their apologies, indicating their commitment to future participation. And at this time, I want to publicly thank all those groups and organizations and agencies that met with us, and the many members of the organizations they represent, for their commitment to national service, their profound enthusiasm, and their professionalism. It was really encouraging to chair that meeting and see the spontaneous, enthusiastic responses that were forthcoming as you shared with us what you have been doing on the ground to provide mental health services to those in need during this time. The contributions of these valuable stakeholders have been instrumental in the development of a national COVID-19 MHPSS response plan. This plan is dynamic in nature and will adapt to the changing psychosocial needs as the technical working group continues to meet, share expertise, very important, identify gaps, and work to ensure that those gaps are filled in a timely manner. Focus areas of this initial plan include coordination, communication, health systems strengthening, public health measures, surveillance and epidemiological intelligence, and research. The plan coordinates the services provided by this diverse range of agencies and groups, those provided by the regional health authorities, and strengthens referral pathways between all these services. I'll now share with you some of the upcoming activities that will result from this collaboration. There will be training for mental health, there will be training for the Ministry of Health COVID-19 helpline responders in order to equip them to respond to better respond to callers who may express concerns related to their psychosocial distress. This will significantly enhance the existing complement of mental health virtual first responders who, through strengthened referral pathways, connect callers to appropriate service providers. In addition, private sector-sponsored employee assistance program services will be provided to Ministry of Health employees who represent a very important subset of our highly valued essential workers. A series of webinars will soon begin and will target specific groups in order to provide support and to build resilience. The Trinidad and Tobago mental health system has responded to the challenges provided by the COVID-19 pandemic in a robust manner, utilizing a collaborative approach among local stakeholders and adapting the best available international technical recommendations to our local context. The COVID-19 MHPSS Technical Working Group will continue to work together to discuss technical aspects of the MHPSS emergency programming in Trinidad and Tobago and share updates, to promote safe and effective MHPSS service approaches consistent with global standards, to harmonize interventions, including training activities and service provision, so that we don't duplicate efforts and our efforts are more effective and far-reaching, to facilitate current and develop new referral pathways among available service providers, and to ensure that MHPSS remains an integral part of the overall emergency response to COVID-19. I thank you for your attention, and I look forward to answering any questions you may have.
Thank you very much, Dr. Fellow. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. TV6.
Hi, good morning, everyone.
Morning.
So just a quick 2 questions to the Minister of Health. Seeing that we have over 500 persons being tested, and well, that would mean that persons are coming to the health centers or to the district medical facility to be tested. But what is many vaccines are being made available to these persons, if any, and how many persons are being vaccinated for influenza and the common flu vaccine on a daily basis? If you can give those numbers, it'd be nice.
Okay.
And Minister, where do you expect, seeing that we don't have the borders open at the moment, and we even have, for the past 3 weeks, no new case of COVID-19, where do you expect the second or the third wave of this virus to come from?
Okay, thank you very much. So thank you for the question on vaccinations, which was given here already. I think the total number of vaccines given out to date is in the vicinity of 112,000. So that's the number of vaccines given out. You asked about vaccinations for the common flu. There is no vaccination for the common flu or the common cold. What we vaccinate against is for seasonal influenza, especially influenza type A, commonly known as H1N1, and type B. There is no vaccination for the common cold. So I hope that answers your question. We still have about 20,000 vaccines to give out. We can't vaccinate people unless they consent to it, and that is a big problem we have globally, that people buy into the anti-vaxxers conspiracy theories, both locally and internationally, and both inside the parliament and outside the parliament. Your question on borders and second and third waves. The second and third waves don't necessarily have to come from outside of Trinidad and Tobago. They can come from inside of Trinidad and Tobago. And yesterday, the chief medical officer said this is exactly what he is looking at now with cases 115 and 116. And we have to wait 2 weeks from the date of confirmation of those cases, as he said yesterday, to determine now whether we will move, as we indicated, from a country classified as sporadic to one with clusters. So I hope that answers your questions.
Thank you, Minister. 98.1.
Good morning, Head Table. Stephen Cummings, 98.1 FM. 2 questions quickly, one for Dr. Othello and the other for Minister of Health, Terrence Deyalsingh. Let's start with Dr. Othello. Dr. Othello, can you give an update on the mental health patient management system at the St. Anne's Mental Hospital? There were earlier reports of the movement of patients that created some discomfort, some uneasiness among some members of the population. And Minister of Health, does Tobago have its own independent machinery for data dissemination on the virus? I'm seeing where its Division of Health and Wellness continues to issue its own COVID-19 updates. The last I saw was the update number 14. They had the number of samples submitted for laboratory tests was at 141. Samples tested positive, 5, number of deaths, 1, and the number of persons discharged, 3.
Okay, so I'll take the second part first, and then we go to Dr. Othello. As the Minister of Health of Trinidad and Tobago, every morning I give the update for Trinidad and Tobago. So you get all the data across the board. So data dissemination, Tobago may want to give their own data, and that is fine, but I give the data for Trinidad and Tobago. Before Dr. Hazel Othello answers the question, I addressed the same question a couple weeks ago when I indicated that the population at St. Anne's has been reduced, and I said clearly it was not reduced due to COVID. It was reduced gradually over the past couple of years as the ministry's plans for decentralization. That is the context in which the population at St. Anne's was whittled down to now I think 750. Let me repeat, it was not due to COVID. It started a couple of years ago under my tenure as Minister of Health, seeing the need for decentralization of mental health services. And now Dr. Hazel Othello can go into the technical part of the question.
Okay, thank you for your questions, Mr. Cummings. Mental health services at St. Anne's Hospital are predominantly inpatient services, so that people are admitted, receive treatment, and once they're well enough to be discharged, they return to their families or to their homes wherever they live in the communities. The services are divided based on what we call sectors, so that many years ago, Trinidad and Tobago were divided into sectors which represent different parts of the country. And depending on what sector you come from, if you have to be sent to a ward at St. Anne's, you would be treated by the doctors responsible for that sector. And those doctors are also the doctors who treat you in the outpatient clinics at this point in time. So they will treat you in the hospital, and when you're discharged and you have to be followed up in the clinic, they would continue to treat you. So there's continuity of care. We have what we call a multidisciplinary treatment team approach in psychiatry, so that the teams are led by a psychiatrist, but the teams comprise psychiatrists, psychologists, social workers, mental health nurses. We have art therapy, music therapy, occupational therapy, and other related services. And these services are provided in a coordinated manner so that each patient receives the complement of services that that patient needs in order to provide that patient with the best possible chance of recovery. There are some patients who stay at St. Anne's for a prolonged period of time. Most of them are persons who have been there for many years. But in the recent years, as Minister did say, the thrust has been towards doing everything possible to assist patients in re-entry into society. Part of that involves risk assessment and risk management, so that if somebody is deemed to present such a risk to society that it is not safe at that point in time to allow them to return home, clearly that person would require a longer period of hospitalization than someone who recovers quickly and can safely return home. While I'm saying that, I want to emphasize that the vast majority of persons with severe mental illness are not dangerous and do not need to have their families protected from them or have society protected from them. Most of them are quite safe to be around. I have been working in psychiatry for over 30 years, and I've never been hurt by a patient. And most of us don't get hurt by patients because most of them are not dangerous, right? And I want to emphasize that, because the more we talk about patients returning to the community, the more we have to emphasize that as we work to reduce stigma against patients in the community so that they can be accepted back into their homes and back into their communities, so that they can access work when they return home, for those who are well enough to return to work, and so that they could continue as far as possible to make a meaningful contribution to society.
Thank you, Dr. Othello. Priya Bihari.
Hi, good morning, Priya Bihari, AZPnews.com.
Good morning.
Morning, Dr. Othello. I just wanted to find out what advice you have to parents and teachers who are writing the CSEC exams and the CAPE and the SEA. So these parents who are very anxious. The children might be very in a state of limbo. Is there any advice you have for them? Any places they can call? And also, can you give us some numbers of the hotlines, the exact numbers that people can call to? That's my question.
All right, the hotline numbers, I didn't walk with that list of numbers this morning because it's quite a long list, and clearly I'm not going to remember all those numbers at the top of my head, but it can be provided subsequently if you provide your email address. I'm sure I can get that from someone and forward it to you. With respect to advice for parents, I think I spoke to this previously, but I'm quite happy to speak to it again, because what I have observed as I practice psychiatry as a psychiatrist is that the levels of anxiety that you see with respect to students and exams, that exists even without COVID-19. And unfortunately, the amount of pressure we put on children in our society to excel contributes to that. And that's something that we have to continue to work on as a society, so that children do not believe that their lives begin and end with one exam, and that if they don't do as well as they want to in that one exam, they don't have a future, right? I like to boast about the fact that I have failed some exams in my lifetime, and it didn't stop me from achieving my goals. So that I say that to encourage students who are overwhelmed. The exam does not define you. I've been saying to some of the young people in my sphere of influence personally, use this time to continue your preparation. I wish I had a little more time for some of the exams that I had to write during my student days, okay? So yes, we know that you didn't look forward to this and you didn't plan this, but continue your preparation, do your past papers, do, read a little more deeply into the topics you've been studying, revise, but also take time for recreation, exercise, play, and play as in play, not swipe a gadget, play, as in get your heart rate up and you're breathing deep, right? Use up some energy. Do those things that contribute to a complete, all-rounded person. And, I encourage parents not to put unnecessary pressure on them, COVID-19 apart. And I think the vast majority of our children will do well. For those who have difficulties beyond that, services will be provided as needed.
Prior on the issue of the hotline, the Ministry of Health's current COVID hotline, we are going to be adding to that now the issue of people phoning in that hotline to seek mental health support. The 18 doctors that we have are going to be trained along that path. Dr. Hazel Othello will be in charge of that. And the same hotline that the ministry set up for COVID about a month ago We will now add this to the normal responses that we give. The number is 877 well. However, they are not ready as yet to deal with psychosocial support, but they will be ready by about the beginning of next week. So I will come to you again and tell you, yes, we are ready, but that's the number, but don't phone it yet for psychosocial support.
Thank you very much. Much needed information. Express?
Good morning, from the Trinidad Express newspapers. I have two questions. One is for Minister Deyalsingh and the other is for Dr. Othello. So, Othello, as you know, Mother's Day is coming up this weekend. And of course, a Mother's Day brunch at Mom's favorite restaurant is certainly out of the question. How do you suggest families to celebrate this, especially those with mothers at long-stay facilities where visits are banned?
Okay,
and
clearly.
the Minister Deyalsingh.
Sorry.
Yeah, go ahead.
Minister Deyalsingh, with the news now that you and the CMO have been speaking about, there's some concern as to how businesses of close contact, for instance, beauty salons, gyms, and barbers will operate. Will there be any workplace guidelines in place for them? Any special workplace guidelines in place for these businesses?
Okay, so I'll take the second part first. As Dr. Sahid Rahman was here yesterday and he indicated, we are developing all the protocols to deal with the whole range of services. And that is why the CMO isn't here today. They are working out all these things, not only for specific industries, but for small business as usual. However, at the end of the day, it's a lot of common sense. So for a barber, both the barber and the customer should be wearing a mask. We shouldn't have to pass a law to say that. The nail technician should be wearing a mask. The customer should be wearing a mask. Don't have 10 people in your small salon waiting to get their nails done. These are all common sense approaches that ought not to require the force of law. Dr. Sahid Rahman spoke yesterday about the common sense approaches. And this is what we have to get across to the population. Nobody should be having a big stick to say in a nail salon, don't have 20 people in a small nail salon. Practice the physical distances. Wear a mask. Put a hand sanitizer. You know, these are all the common sense public health measures that I could recommend to gyms, barbers, nail salons, nail tech people, makeup artists, everybody. Okay? Thank you, and over to Dr. Othello.
Okay, these are different times from what we're used to, so a number of our normal cultural events have to be experienced in a different way from the way we usually do it, and Mother's Day is going to be one of those experiences this year. Clearly, we're going to have to celebrate our mothers virtually, right? We're going to have to celebrate them virtually. I haven't hugged my parents since all of this started. When I have to drop off stuff for them, I drop it at the front gate and wave to them and drive off, and then they come and pick it up and, you know, go through the whole ritual of removing outer packaging and sanitizing and everything else. That's what we have to do to stay safe right now. So I would suggest that you make that telephone call and express your love and your appreciation for your mother that way. If you have access to Wi-Fi, clearly, and if you have you know, video capability via WhatsApp or via an iPhone or something like that, then clearly you can have a little more of a visual experience because you can see her and she can see you, and you know, that can improve the experience a bit.
Okay, I just want to give some additional information to Prior on hotlines. So hotline numbers under the Mental Health Services Directory, 800-WELL, 877-WELL, and for Tobago, 800-HEAL or 800-4355 for Tobago. So those are some numbers that are available.
Thank you. Power 102.
Good morning, Head Table. Kimberly D'Souza from Power 102 and Isle Media. My question is for Dr. Othello. Dr. Othello, just piggybacking off of Prior's question a bit, but as it relates to violence, the gender-based violence, 58 persons have been arrested for the year thus far against crimes against children. And I know a lot of parents may not have expected to be at home with their children for this length of time, so they are becoming a bit frustrated. Do you have any coping mechanisms that you can give parents at this time, just to help them cope with having their kids, at home? Thanks.
Okay, I've shared a lot about coping mechanisms during the previous times that I've been on this program. And what you have to realize is that it's the same coping mechanisms that you apply to different situations, right? So there's no new cadre of coping mechanisms that going to just drop from the sky. With specific reference to the children, clearly you have to speak to them in a different way from the way you speak to adults so that they understand what you're saying. Recently, somebody told me she had to sit down her 2-year-old and explain when mommy is at that desk, mommy is at work. And when mommy is at work, you are at school. So he goes outside and plays with his toys. That's his version of school at age 2. And he knows that once mommy is at that desk, he cannot disturb her because she's at work. And those are the things that children have to learn during this stay-at-home experience. I know some parents are getting frustrated with having to teach their own children in terms of coordinating with the visual schooling and so on, and having to deal with the Miss says so, and that is not the way Miss does do it experience. So I know that takes a lot more patience because, Miss is almost like God in the eyes of your children, and mommy is only mommy, But try to be patient. Try not to go for prolonged periods of time. Children have short attention spans. So don't try to keep a 5-year-old sitting with a book for an hour or 2 hours. That's not going to work. So you give them short bits, and then you give them a break and let them have some fun and try to keep them occupied as much as possible. This is a good time to put in a plug for reading because a lot of our children don't do enough reading. They play with devices all day and, encourage them to read, right? There's a lot available. There are lots of reading resources that are now available free of charge on a number of sites for those who have access to the internet. Okay, so there are lots of things you can do. There are games you can play with them. Be creative, be spontaneous, and really, above all, try to be patient so that you don't respond to your child in an angry manner that confuses that child or causes them undue distress.
Dr. Othello, if I could, with the permission of the media, if I could play media personnel here now and ask you a question. Is there any truth to the opinion that children feed off the anxieties of parents, and as parents get more frustrated, that children feed off that? And what advice could you give to parents?
Yes, children do respond to what is happening emotionally in their environment. If you would notice, even the smallest child, if you're at like a funeral setting or anything like that and people are crying, the child starts to cry as well, even though the child does not know why people are crying. So they do experience the emotions of those around them, and sometimes it can be quite distressing and quite confusing to them. And that is why it is important to talk to them at an age-appropriate level so that they understand mommy feels hurt sometimes, just like you feel hurt sometimes. Mommy gets upset sometimes, just like you get upset sometimes, but we have to respond to that in a way that doesn't hurt somebody else. So because mommy is upset, mommy is not going to hurt your feelings or do anything to hurt you. So we have to talk to them in simple words, and if you did something that could have hurt your child, please apologize. None of us are too old to apologize, and children understand that.
Sunil Lala.
Hello, good morning. Sunil Lala, Caribbean Lifestyle Communications.
Morning.
To Minister Deyalsingh, just for the sake of clarity, can you tell us the 500 plus community testing that is being done, is that included in the number of samples that has been submitted to CAFA, the 2114? And secondly, the Trinidad Public Health Lab, are they conducting tests just as yet?
Okay. So yes, those 500 tests are included, and Trinidad Public Health Lab does not conduct COVID-19 tests. Trinidad Public Health Lab receives the samples, receives the paperwork, determines if the paperwork is correct and so on, and then submits the test to CARICOM for testing. So TPHL, Trinidad Public Health Lab, does not conduct tests. Tests are only conducted in Trinidad and Tobago right now at CARICOM and at the UE Virology Lab near the vet school in Eric Williams. Those are the two labs that we have up and running. And in short time, I can't give you an exact date, we expect to have another lab in Southwest, as I indicated, and the priority is for Southwest and Tobago to have their own testing in the shortest possible time frame.
Newsday.
Good morning, everyone. In Superville from the newspaper here. I have two quick questions. The first one for Minister Deyalsingh. I don't know if you have gotten the chance to see the results of a study conducted by Market Facts and Opinions, in which it showed the public had a general support towards the efforts of the government in addressing the COVID-19 outbreak. Just wanted to know your thoughts on that. And the second one would be directed to Dr. Othello. Just wanted to know if the ministry from the mental health aspect would have had any understanding of the mental health use some people may be experiencing as they stay at home and quarantine.
Okay, so thank you for your question, Shane. Yes, I did take a look at the MFO report, and I think in your newspaper this morning, where I think 8 out of 10 persons were happy with the health response. I think that is reflective of the studied, robust, and incremental approach that the government led by the Prime Minister took from as early as January 30th. I think it also bears testimony as to the expertise of our public health officials, our nurses, our doctors, to manage this pandemic. You may recall that there is no rule book for this. There is no rule book. We had no previous experience dealing with a COVID global pandemic. And I think what you saw in the MFO report is testimony to the ability of our public health response, the caring and compassion of our nurses and doctors. I am grateful for it. However, with all these good reports that we get, whether it's from MFO, World Bank, whatever, it is not an excuse to take a victory lap. I keep saying that because sometimes I think these good reports could work against us. So let's accept it, but we have not won anything. The virus is still out there. Thank you.
Thank you. Dr. Othello?
Okay, I think your question was about the mental health impact of the stay-at-home and quarantine measures. This whole experience is very different, as Minister has said, from anything we've experienced before. And none of us are used to having to stay at home all day long for several days, which rolled into weeks, which, you know, it's had an impact, clearly. As I said in earlier news conferences, change is different for everybody as they experience it. And change can sometimes be very difficult to cope with. So different people have responded in different ways, clearly. But for some people, it has been more difficult than for other persons, particularly people in difficult situations, as someone else mentioned, people in situations where they're at risk for domestic violence. Clearly, situations like that could become particularly charged. Persons who are not currently at their place of employment and are not earning are subject to different additional stressors. There are a number of things happening that can be quite stressful to cope with. And as we see those experiences, clearly we are aware that it increases the risk for anxiety responses, for depressed mood, and with the deaths in our families that we're not able to grieve in the normal way. Clearly we have that risk for complicated grief reactions. so that mental health service providers are preparing themselves to deal with those kinds of outcomes in the months ahead. In addition, people who are already on the ground providing services are talking to people. The many hotline services that we mentioned, they are talking to people and providing psychosocial support even as we speak to try to ameliorate those kinds of effects, so that if we can help people up front by providing them with the support they need while they're going through it, it reduces the risk for any kinds of adverse mental health outcomes.
I-95.5.
Good morning to everyone. Whitfield Turner from I-95.5. Dr. Deyalsingh, I believe this question...
Mr. Deyalsingh.
Okay, Mr. Deyalsingh. Yes. Have any officials from the ministry been visiting the rehab centers across the country to ensure that they are adhering to the guidelines as outlined and that they have all the supplies and materials needed at this particular time? And for Dr. Othello, will the Ministry of Health be calling on the skills of persons, and this is with a view to planning for the second and third waves? Will the ministry be calling on the skills of persons in the community who may have skills in behavioral science, counseling, and so forth, to assist the ministry in going forward in terms of ramping up capacity and building redundancy, and the role in this too of the media, whether the media should play a particular role, maybe in terms of adjusting programming and adjusting the type of music that is being played and so forth?
Okay, so thank you for your question. I will take the first part. So under the Ministry of Health, there's a monitoring and evaluation unit to deal with homes that deal with substance abuse. That will fall directly under NADAP. So I don't have an answer for you now. That's a very serious operational question. But I will check with NADAP, and possibly when we are here tomorrow at a future date, I can tell you exactly what NADAP is doing as far as monitoring and evaluation of these rehab centers are concerned. Thank you.
Okay, with respect to your question about persons being added to our cadre of mental health services, that was the very purpose of the setting up of the technical working group, because we are aware that there's a wealth of resources out there that we cannot do this effectively without. That's why we contacted as many of these groups, agencies, organizations that we could have. And as we find out about more, we will certainly incorporate them so that we are aware of what services they are offering, so that we know which persons can be referred to their services, and they know which persons they can refer to the Ministry of Health Services, so that with that collaborative effort, all persons will receive the services that they need. With respect to the role of the media, it is in fact a very important role. You would be aware of the importance of accurate reporting. You know, a lot has been said with respect to the additional stress placed on the public by what we call fake news, particularly, and this pandemic has been very different from any other global emergency in that regard, because people have put all sorts of strange things out there that increase other people's level of anxiety if they're not careful. So that, you know, the importance of accurate reporting, and also you have a role with respect to information that agencies such as the Ministry of Health would be putting out from time to time to help the public. So as we make more resources available in terms of messaging, targeting various groups of individuals, various vulnerable groups perhaps, on how they can better cope, your role would be of utmost importance in getting those messages out.
91.9.
Hi, good morning. We're next to 91.9 FM. Dr. Othello, I believe I noticed that you mentioned some private sector sponsored, what I would call EAPs for ministry staff, and it brought me to the question to ask if we have sufficient mental health professionals in the public service and what that number looks like. And it also leads to the question, has the ministry specified or identified specific mental health professionals to treat with ministers in particular, especially ministers who have, some significant roles like the Prime Minister, the Minister of Health, National Security, etc. Could you give us some information on that, please? Thank you. Morning.
Okay. With respect to mental health services for professionals and employee assistance programs, many of the RHAs already have employee assistance programs up and running that provide mental health and psychosocial support to their workers. So that exists as we speak. With respect to the ministers, the good thing about something like what has been offered from the private sector is that it would allow, even if necessary, ministers, if they need that level of support, it would allow them to access that support in a way that guarantees their confidentiality, their autonomy, their respect and their integrity being, provided in a way that doesn't make them feel uncomfortable to access those resources. I've spoken about stigma so much, and it's one of the barriers to care, and it's something that we all have to be sensitive to, because many times when people need services, it's hard to admit to yourself that you need such a service. But if the services are provided in a way that maintains confidentiality and all those things, it's easier for people to accept that they need it. So I don't think that if a minister needs such a service, I don't think there would be any barrier to them receiving that service.
But Vern, I want to thank you for looking after my mental health, but I'm fine. I will be with you throughout this entire process. I promise you that.
Loop Titi.
Hello, good morning.
Morning.
Siona Felix here from Loop Titi. I have two questions, both for Dr. Othello. The first is, what are some signs that people should look out for to determine if their anxiety or their stress has escalated to a point where they should seek professional help? And the second question is, people are sometimes resistant to seeking professional mental health for themselves. What practical advice or options are there for relatives of someone who may be experiencing a serious mental health issue or episode of some sort?
Lovely.
Dr. Othello?
Okay, I got your first question. Can you please repeat the second question?
Oh, sure. Yes. I said people are sometimes resistant to seeking mental health support themselves. So what practical advice or options are there for relatives of a person who may be experiencing serious mental health issues or episodes?
Okay. All right, with respect to the first question about signs of anxiety, when we are anxious, what tends to happen is that we begin to experience physical symptoms. The body responds to stress in a way that we're all aware of, in that the body prepares itself to act. For instance, if you see something like, a Rottweiler coming straight at you, you prepare yourself to either run away, what we call flight, or to take on that Rottweiler if you feel you have the capacity to do so, what we call fight. So a lot of biochemical changes start to take place in your body to prepare you for that. What happens with anxiety is that we have those physiological changes taking place without necessarily there being a stimulus. There is no thing in front of you that's going to attack you, but you feel the same way. So your heart rate increases. You may sweat more. You may feel overwhelmed. You may feel really, really, as though you're not quite yourself, or almost unreal feeling. And when we start to experience those things, the average person can know, they would say, I'm feeling tense. They tend to describe it that way. Sometimes the lay person would say, I'm feeling nervous. That's how they would react. And sometimes, in the early stages, with relaxation exercises and so on, we can lower that anxiety level by doing something relaxing that take our mind to a different place and so on. However, if it is so overwhelming that, for instance, the person's heart is racing and they feel as though they're going to die, and it's the first time they're experiencing this, so they don't know what it is happening to them. Clearly, that person would need some medical intervention. And the other role of medical intervention in that situation is, of course, to make sure that that person doesn't have a real physical problem, such as a heart attack or asthma or something like that. So we rule out the medical causes of those symptoms. And if there are no medical causes, then we treat them for the anxiety that they're experiencing. The two key things that you look for is the severity of the symptoms and the stress that comes with that, as well as the dysfunction. In other words, you're not able to go about your normal activities and do the things you would normally do because of the level of distress that you're experiencing. So whenever there's excessive distress and excessive dysfunction, intervention is necessary. The other part of the question with respect to those who resist seeking help is that it's very important for relatives, as far as possible, to try to talk to that person, to say to them, listen, I love you too much to leave you this way. I'm seeing what's happening to you. I'm concerned about you, and I want to make sure that you get the help that you need. We don't think that because of this you're a bad person or you're a wicked person or an evil person. We don't think it's anything bad about you. We realize that you're not at your best, and we want to help you, right? And that sometimes with that, people do accept the help. There are cases where the severity of some psychiatric symptoms makes it difficult for that person to accept help, and that is when you need to access the assistance of mental health service providers, so that in the event that that person requires hospitalization, and in particular, if that person needs to be hospitalized against their will, which doesn't happen in the vast majority of cases, but when it does happen, we have to ensure that it is done in accordance with the Mental Health Act of Trinidad and Tobago, respecting that person's integrity and autonomy and their human rights.
Thank you, Doctor. Guardian Media Limited.
Hi, good morning. My questions are for Dr. Othello. As you mentioned earlier, with Mother's Day coming up, a lot of people will have to be conversing with their mothers virtually. Of course, a lot of people have turned to social media in this time. But I'm wondering if the social media has become a bit of a double-edged sword in terms of contributing to mental health, anxiety, and other problems. And my second question, with regard to the mental health plan that will be coming out going forward, what role would the lesser traditional forms of therapy, like say art therapy, would play in that plan?
Okay, with respect to the social media, I think I mentioned before the fact that some of the things that are posted on social media can have a deleterious effect on persons' mental health. There have been reports globally, even before COVID, of particularly people I think they call themselves social media influencers, and they have large numbers of people following them, and they earn money by promoting products and things like that. But sometimes those same people following them turn on them because of something they may have said or done, or for some frivolous reason sometimes, and start to put negative comments on those pages. And there have been persons who have had very serious mental health outcomes as a result of that. It's one of the reasons why we always encourage parents to be aware of what your children are doing on social media. Cyberbullying is a very real entity, and it can be very, very cruel, and it can have horrible outcomes sometimes. So that we have to be careful of what we expose ourselves to on social media, and for minors, what you allow your child to be exposed to on social media. With respect to the other therapies, and I do not call them lesser therapies because in my view they are equally important. We have different modalities of providing care, but they all have very important roles. At St. Anne's, we are proud to have a music therapy, art therapy, occupational therapy, and if other therapies presented themselves while I was there in terms of other, like dance therapy and other things, I would have been the first one to say to the board, please create a post so that we could hire that person. Those people are very, very valuable, and they make a very important contribution to mental health.
Thank you very much. TTT?
Good morning, Ian Wilson, TTT News.
Morning.
Previously, Dr. Hines stated that 700 persons were identified through contact tracing and they were being monitored for symptoms. Have we any update on that and how many of them would have been tested for COVID?
Okay, so Ian, I wouldn't have that level of detail with me, but I will endeavor to get it for you. Thank you.
Ian, are you there? Okay, I think we lost him. At this time, the Minister of Health, the Honorable Terrence Deyalsingh, will now give a closing statement.
Thank you very much, Minister Cox. And thank you, ladies and gentlemen of the media, for tuning in. And thank you to all citizens who have tuned in. Today, we address a very, very important topic. It is one of these topics that we identified at the Ministry of Health in 2015, 2016, the issue of mental health as one that needs to be put on the front burner. For too long, it was on the back burner. The issue of decentralization of mental health was being spoken about in this country since the 1960s. With COVID, mental health is going to become one of the key functions of the health system. In addition to treatment, in addition to step-down facilities, we cannot and will not at the ministry ignore the real, very real consequences of what prolonged periods of isolation at the national level, but also at the individual level. Those individuals who were quarantined, who lived through COVID, we have to be cognizant that the country's psyche is going to be affected. That is why at the ministry we took this very proactive step, and I hope to bring back Dr. Othello in the future to drive this process further. We will make all the telephone numbers available so that persons in the privacy of their home, because one of the questions was about people not seeking mental health because of fear of stigma, being ostracized from their families. So we are going to ramp up our I'm using the word telemedicine loosely here, because that's the best way to tackle this very important issue at this point in time. So Trinidad and Tobago, I want to thank you for all the support you have given us at the Ministry of Health, and we look forward to serving you in the coming days, months, and years. Thank you very much.
Thank you, Minister. Thank you, Dr. Othello. Thank you, members of the media, and thank you to the listening and viewing audiences. We have come to the end of today's media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. We would like to remind you to send your suggestions on the way forward for Trinidad and Tobago post-COVID-19. The group of government ministers, businessmen, and economists, led by the Prime Minister, Dr. the Honorable Keith Rowley, are happy to hear from you. They are tasked with creating a roadmap to recovery, and we are inviting you to be a part of the discussions by visiting the government's official website, ttconnect.gov.tt, to upload your submissions. Let your voices be heard. Please share your views on issues facing your community, industry, or any ideas on the way forward for Trinidad and Tobago. Please go to ttconnect.gov.tt. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.